May is National Women's Health Month, and this morning in today's checklist, we're focusing on longevity. According to the CDC, the average life expectancy of women in the United States is 80 years old, compared to 75 for men.
Jeez.
Here with a look at why women are living longer is Dr. Elisa Port, Chief Breast Cancer Surgeon at Mount Sinai right here in New York. Dr. Port, good morning.
Thank you for having me.
So jokes aside from Al Roker, but
Yes.
Women are living longer.
Yes.
What is the main reason for that?
Women have been living longer than men for quite a long time now, that gap. We think it's a lot related to genetic factors, for sure. There are definitely lifestyle and behavior factors. And for sure, women seem to be the ones that are more proactive about going to the doctor and getting checked, getting screened. So perhaps better at picking things up earlier when you can intervene before it affects their long-term health.
I mean, 5 years is a substantial gap between the average lifespan.
Sure is.
So women are living longer.
Right.
Are they also living healthier lives?
It's a great question, and I think you're differentiating and you're pointing to the fact that there's a difference between lifespan and health span,
Correct.
the number of healthy years that you have. And one of the problems is that we're seeing is that even though women are living longer toward the ends of their lives, they are dealing with issues that make them less healthy. Cognitive issues, bone density issues, and so forth. So the longer we live, what we've got to do, start doing as women and as men, is front-loading our healthcare practices so that as long as we live, we're still very healthy. You don't want to spend the last few years of your life as a professional patient, you know?
Yeah. So what do you do, men or women? How you talk about front loading. What do you do to help, lessen that gap?
Sure. A lot of it, Al, is about just basic, all the things we know about. You know, I always say the smoking in the 70s and 80s is now about weight, being overweight and obese. That is really an epidemic in this country. And unfortunately, it's starting much earlier. You know, about 30 to 40% of our population now is overweight or obese. And in a very, very concerning way, we're seeing it also in our younger populations. As early as 12 to 19 years old, you have a 20% risk of obesity. So,
I see you've got movement there.
Yes.
They talk about sitting is the new smoking.
I think that's partly true. You know, the sedentary lifestyle, the working in front of computers, kids on phones, all of those things contribute to weight, contribute to lack of movement, and it all rolls into one funnel, which is weight.
What about preventative care? What screening should women be doing now to, help live a healthier life?
Sure. Of course, as a breast cancer surgeon, I'm going to advocate for mammograms. Absolutely annual physical. It's important to know that the number one killer of both women and men in this country is not breast cancer. It's actually heart disease. So that's picked up in the annual physical. Mammograms starting at age 40 or younger if you have a family history. One of the things I'm always so happy to say is now the overall cure rate for breast cancer, which is the most common cancer women get, is now 91%.
Wow. That's impressive.
Okay, so it's a huge reason for optimism, but we can only achieve those results through early screening. Of course, colonoscopy, pap smears, bone density is a big one. Women, as they get older, slip and fall, fracture a hip. It's a huge source of, morbidity and mortality in older women.
This is very, very helpful. Thank you so much, Dr. Port.
Thank you for having me, as always.
Absolutely.
Hey, thanks for watching. And don't forget, you can catch the Today Show every morning on NBC or take Today when you're on the go. Just follow the Today podcast on Apple Podcasts, Spotify, or wherever you listen.